Thanks for coming back to join me at Med School Radio. We're going to take a look at some more of the USMLE question summaries. So let's get right into it, reading summaries of the questions. Hair cells on the proximal region of the organ of Corti, where the basilar membrane is thinnest, are responsible for high-pitched sound perception and are frequently lost in presbycusis. Multiple sclerosis, or MS, is a clinical diagnosis characterized by at least two separate attacks with at least two different clinical lesions. Remember, separation in time and space. The most common symptoms of MS include motor and sensory deficits, asymmetric, visual symptoms, vision loss or diplopia, and gait or balance disturbances. Organophosphate poisoning manifests as excess cholinergic activity, and we're talking about diarrhea or defecation, urination, meiosis, bronchospasm, bradycardia, excitation of skeletal muscle and CNS, lacrimation, sweating, and salivation, or the dumbbells. Atropine, which acts as a competitive inhibitor of acetylcholine at muscarinic receptors, is the treatment of choice. Pralidoxime is recommended as an adjunct therapy for organophosphate poisoning. The tricyclic antidepressants, or TCAs, including amitriptyline, are known to cause anticholinergic adverse effects, including dry mouth, blurry vision, confusion, constipation, tachycardia, urinary retention, and hot, dry skin. Neuroleptic malignant syndrome is a rare but sometimes fatal adverse effect of antipsychotics. Patients typically present with muscle rigidity, fever, autonomic instability, and delirium. Treatment includes dantrolene, supportive care, and discontinuation of the antipsychotic agent. Burkitt lymphoma develops following the T814 translocation and activation of the CMYC, and presents with a starry sky appearance due to dark staining of lymphoid tumor cells with interspersed light staining, tangible body macrophages containing phagocytosed apoptotic cells. It is commonly associated with Epstein-Barr virus infection. So remember, Burkitt lymphoma, T814 translocation and activation of CMYC. Patients with increased estrogen, for example, pregnant patients, those on hormone replacement therapy, have increased thyroxine-binding globulin levels, or TGB levels. These increased TGB levels lead to an overall increase in total T4 and T3 in the setting of normal TSH and a normal free T3 and T4. So that is regarding patients with an increased estrogen level. GCA is a chronic vasculitis of medium to large arteries, most common in people greater than 50 years of age. The most common affected vessel is the superficial temporal artery. Biopsy of this artery is important for diagnosis. And continuing on, in the presence of fever, rash, and deteriorating renal function following antibiotic use, consider acute interstitial nephritis. Common culprits include penicillins, cephalosporins, and sulfonamides. One would expect to see white blood cell casts and eosinophils in the urine, as well as Fe and A greater than 2%. Executive function The ability to organize and perform tasks can be tested by the clock drawing test, an element of MOCA. This is done by asking the patient to draw a clock oriented to the time requested. Anaplastic thyroid carcinoma is an undifferentiated and aggressive tumor that presents with a rapidly enlarging neck mass and regional metastatic spread. Reed-Sternberg cells are pathognomonic for Hodgkin's lymphoma. Hodgkin's lymphoma may be associated with Epstein-Barr virus. Fever, weight loss, night sweats, pruritus, and cough are among the list of presenting symptoms. A family history of multiple family members with breast cancer diagnosed at an early age, less than 40, should raise the suspicion of a genetic susceptibility to breast cancer, such as BRCA1 or BRCA2 gene mutation. Patients with such histories should be monitored closely. Uterine prolapse is relatively common in multiparous women. It is due to the loss of support by the cardinal, uterosacral, or pubocervical ligaments that suspend the uterus in the pelvic cavity. Stretching of these ligaments will allow the uterus to prolapse, as they can no longer counteract intra-abdominal pressure. Complications of uterine prolapse include bilateral hydronephrosis and ultimately pyelonephrosis. Hereditary spastic paraplegia is characterized by progressive degeneration of the lateral corticospinal tract and subsequent lower extremity weakness and spasticity or stiffness. The lateral corticospinal tract contains motor neurons that control descending voluntary movements of contralateral limbs. Yolk sac tumors of the testes typically manifest as a testicular mass in infants or young children and are characterized by an elevated AFP level. The tumor can be distinguished histologically by Schiller-Duval bodies, pathognomonic for yolk sac tumors, which resemble primitive glomeruli. Von Willebrand's disease is characterized by platelet adhesion defects due to lack of VWF and may also manifest with coagulation defects depending on the severity of von Willebrand's disease and concomitant reduction in serum factor VIII levels. Patients typically present with easy bruisability and prolonged mucosal bleeding. Bleeding time is elevated and the PTT may be normal or increased. Factors that increase estrogen exposure are associated with enhanced breast cancer risk. For example, late menopause and early menarche. Metyrapone inhibits cortisol synthesis by blocking the conversion of 11-deoxycortisol to cortisol. In response to metyrapone administration, individuals with primary adrenal insufficiency develop an increase in ACTH, but their levels of 11-deoxycortisol and cortisol remain low because their atrophic adrenal glands cannot respond to ACTH. Granulosa cell tumor, or GCT, of the ovary often presents as a large unilateral ovarian mass with signs of estrogen excess, for example, postmenopausal bleeding, thickened endometrial stripe, or precocious puberty. The diagnosis of GCT can be confirmed on histology by the presence of Cal-Exner bodies, which are cuboidal cells in rosettes with grooved nuclei. E. histolytica can be identified by observing trophozoites with phagocytosed red blood cells in the stool. E. histolytica infection manifests as bloody diarrhea with mucus after travel to endemic regions. Liver abscesses may also be present. Cushing syndrome is characterized by weight gain, abdominal striae, moon phases, poor wound healing, and facial plethora. Small cell lung carcinoma can cause paraneoplastic syndromes, including Cushing syndrome, SIADH, and Lambert-Eaton myasthenic syndrome. Hodgkin lymphoma presents with constitutional symptoms and localized peripheral lymph node involvement with mediastinal lymphadenopathy. The nodular sclerosing subtype is the most common form. Defective fibrillin in Marfan syndrome predisposes patients to aortic dissection, which may lead to cardiac tamponade. Low voltage QRS complexes with electrical alternans on an ECG are characteristic of this condition. Antiphospholipid antibody syndrome, or lupus anticoagulant, is caused by antibodies directed against platelet phospholipids. It is associated with increased coagulation times, recurrent thrombosis, and miscarriages. TGV, a congenital cyanotic right-to-left shunt, results from the failure of the aorticopulmonary septum to spiral. This condition manifests with neonatal hypoxia and an egg on a string appearance of the heart on chest x-ray. We're talking about transposition of the great vessels here. Elevated alpha-fetoprotein levels in maternal serum during gestation are associated with open, for example, not skin-covered, NTD, such as meningocele, myelomeningocele, and encephalocele, and anencephaly. Normal alpha-fetoprotein levels are found with spina bifida occulta. NTDs or neural tube defects can often be prevented with adequate maternal intake of folic acid. Preeclampsia is characterized by hypertension, proteinuria, and edema at or after 24 weeks gestation. Major complications include disseminated intravascular coagulation, or DIC, HELP syndrome, and acute tubular necrosis. DIC is confirmed and monitored by fibrin split products, for example, D-dimers, prothrombin time, partial thromboplastin time, and platelet count. So thanks very much for joining me for that session, a review session. Stay with me. Come back another time to hear some more of Med School Radio.